Thanks very much. I'm here with Senator Ben Cardin of Maryland. I just wanted to say a few words on one aspect of this legislation. In the midst of the overall healthcare crisis in America, there's one particular crisis that Senator Cardin and I and others have focused on, and that is the crisis in primary healthcare. And that means that some 60 million Americans today do not have access to a doctor on a regular basis. And what that ends up meaning is that when people get sick, they end up in the emergency room, or they become sicker than they should have been and they end up in the hospital, a great personal suffering and pain, and sometimes in death. We have 45,000 Americans every single year who die because they do not get to a doctor on a regular basis. What this manager's amendment today does is add $10 billion more over a 5-year period into community health centers in the National Health Service Corps. What that will mean is that an additional 25 million Americans will now have access to federally qualified health centers, which means high-quality primary health care, dental care, low-cost prescription drugs, and mental health counseling. It also means, because of a very significant increase in the National Health Service Corps, we're going to be forgiving debts incurred by medical students who go into primary care. 20,000 more primary health care physicians and dentists and nurses will be developed as a result of the increased money in that provision. So I can tell you that in my state, where in recent years we have significantly increased community health centers, it has a profound impact on the health and well-being of our people. And at the end of the day, what studies indicate is Medicaid saves money because we keep people out of the very expensive emergency health rooms and we keep them out of hospitals. So this is a win-win proposition. We have $10 billion now in the Senate bill. Working with our colleague Jim Clyburn in the House, they've got $14 billion in the House bill. We believe that the final number will probably be $14 billion. And if that happens, there will be a revolution in primary health care in America. 25 million more people having access to high-quality health care, dental care, mental health counseling, and low-cost prescription drugs. Let me introduce Senator Cardin.
Well, first I want to congratulate Senator Sanders for his leadership on this. I have sat through many of the meetings of our caucus where Senator Bernie Sanders has raised this issue over and over again. And let me try to underscore how important this is. We all know we have a shortage of primary care health care professionals. We also know we don't have enough facilities in our community to handle all of our population who want to seek health care. Senator Sanders and I have been fighting for many, many years for universal health coverage. This bill is going to do a great service to America in getting a lot more people insured. 31 million is what the Congressional Budget Office, and we hope it will even be more than that. But the question is where they're going to get their health care needs met. We don't have enough primary care physicians today. We don't have enough space in our clinics. I have visited the community health centers in Maryland. They have one thing in common. They all need more capacity. They already are stretched in capacity as to what they can handle. We need more locations, particularly in the rural areas where people are having a hard time finding primary care help, and we need more capacity generally throughout our nation. I had a chance to talk to one of the leaders at Johns Hopkins Hospital in Baltimore, who's a strong proponent of this bill because he believes that America, we should have universal access to affordable health insurance. But he told me that if we don't do something to produce more healthcare primary care professionals, and if we don't provide more community health center capacity, that we're not going to be able to provide the care in the most cost-effective way. The bill that we had on the floor of the United States Senate needed to be improved in this area. And Senator Sanders has accomplished that. And I know that there's a great deal of focus on some of the major controversial issues. But our objective is to make sure every American has access to affordable health care. And Senator Sanders' initiative will help 25 million more Americans reach that goal. Congratulations, Senator.
Any questions?
Senator Sanders, Senator McConnell singled out Vermont along with Nebraska as receiving sort of special favors in the bill. Can you respond to that?
Yeah, he used the term sweetheart deal.
Yeah, right. You know, Vermont was, and I don't have all the details in front of me, Vermont has been very aggressive in making sure that all of our low-income kids and others have access to health care. We were there and doing the right thing. And what many of us in Vermont and around the country felt that it was wrong to penalize a state that had done a better job than perhaps any other state. I think Massachusetts was up there as well. You don't penalize states because states on their own come up with money to do the right thing and say, thank you very much for taking care of your low-income kids. Thank you for taking care of more people percentage-wise than other states, and now we're going to penalize you for doing that. We did not think that that was right. So that's not a sweetheart deal. That is saying you're not going to penalize states that have done the right thing. And we're proud in Vermont that we've done the right thing. But our taxpayers should not be penalized because they've done that. But the bottom line here for me on this bill, as Senator Cardin said so well, is that if you expand Medicaid and if you expand health insurance in general, that is enormously important. But at the end of the day, it doesn't mean much if people can't find a doctor or they can't find a dentist. And what we have managed to accomplish is to substantially increase community health centers. 10,000 communities in America, as a result of this legislation, will now have access through community health centers. 10,000 more communities, 20,000 more primary health care physicians and dentists. And we think that that is going to help revolutionize primary health care in America and is a really important step forward in health care reform. Okay? Great. Thanks very much.